just being aware of how kind of crazy it is that we send boxes of medications to patients going through fertility treatments.
Alexa Costa knows needles.
All you have to do is breathe.
Costa is a board-certified nurse and the co-founder and CEO of LexRx, an aesthetic injectables practice. She's also a mom of two, daughter Capri, an IVF miracle.
What was your average day like when you were going through this? How many times a day were you having to do it?
So I was always in a panic to get home by a certain time, mix the medications properly, store them properly, show up on time for appointments, and it really is a lot to go through it.
Costa found herself rescheduling many of her patients to stay on top of her own injections and doctor's appointments. But what started as a scheduling headache turned into something incredibly meaningful.
When they would say like, oh, you have an appointment, like, what are you doing? And I became very transparent and open with my customer base that I was going through IVF treatments in the hopes to have a second child. And it really opened the conversation for my patient population to say, maybe they were going through it too. A lot of them shared their fears and anxiety around administering the medications. I had two patients of my own that said, I had 2 rounds fail because I messed up the medications. And that just kills you because the meds are expensive. It's incredibly time consuming. So to feel their heartbreak really spoke to me.
What was the conversation like?
They almost wanted to ask, like, would I be willing to help with the injections? I do their Botox treatments. I do other services for them. They trust me with a syringe and a needle. And for me, it just felt like the best way to pay it forward was to really help my own clients going through this journey.
So Costa began seeing patients after hours, helping with their hormone injections completely free of charge. One of them happened to be her cousin, Marissa Penta. She and her wife both went through IVF cycles in hopes of getting pregnant, attempting to handle injections on their own before eventually turning to Alexa.
It was very anxiety-provoking, very stressful to have to do it ourselves.
How did you feel when you had someone who could administer it and you weren't having to use the needle yourself?
It was like a weight lifted.
It's a lot of shots. It's a lot of blood draws. It's a lot of ultrasounds. The number one reason why people drop out of the process is that it's so physically hard. To paint you a picture, when patients start the IVF process, they get a box at home that has dozens of needles, syringes, medications.
Alexa and Dr. Pietro Bortoletto of Dedham-based Terra Fertility are currently working on making that process feel a little less crazy. The hope to take the pressure off patients and send trained nurses to their homes to handle injections.